This is Debbie, and I want to demonstrate that she has fairly symmetrical range of motion of her hips. The traditional way of testing it is with a patient sitting and the hips and knees are bent 90 degrees, or on their stomach with their hips and knees bent 90. Just relax, I'm going to do the testing. So she's got plenty of external rotation. That's looking like it's, 70 degrees, okay? And I'm holding her hip at 90 degrees. Internal rotation in this context is about 30 degrees, and I can still give it a little overpressure, and that's good. You want to have a springy end feel, okay? Just relax, let me do the movement, okay? So external rotation is quite similar, and let me walk over to that side. All right, that's more comfortable for me. Yeah, quite similar, okay? And then internal rotation is also quite similar. I think she's a little more like 35 here, maybe approaching 40. So a little bit of difference there, but at the end, I can give it that little spring, and that's good. Healthy joints have that little bit of end feel spring, okay? I like to test also this context, okay? And this is because functionally, when people stand or walk, there is a degree of pelvic rotation, pelvis rotating on the top of the hip, on top of the round ovoid femoral head, the top of the thigh, right, the true hip joint. And so I like to test it in this context. And in this way of testing, I often find restrictions that do not present when you have the hips and knees bent, okay? So again, I just roll the leg in to end range, and then I spring it, okay? I'm gonna do the same thing on this one, and she's got, plenty of internal rotation in that context, okay? What I wanna show is that she does have a reduction of micromotion springing through the back of the trochanter. So let's have you lie on your stomach, and let's walk over and show my skeleton in the closet, the trochanter. So here is the true hip joint, okay? Quite rounded like a ball. And then this projection is the trochanter, okay? And the back of the trochanter is quite generous area there, and that's where I'm going to test spring mobility, okay? I don't think you'll see this test in any book on testing the hip, but if I'm wrong, I'll be delighted. All right, so you can easily find the trochanter by rotating the leg in and out and putting the palm of your hand on the outside of the pocket area, okay? And so her trochanter is right there. I put my palm on it, and I'm going to push it towards the floor, okay? And you can see that there was some movement available, and now I'm going to give it a thrust of about 15 pounds, and it springs forward and it recoils, okay? This trochanter, I'm not able to take up the slack. There's no movement there. And so if I use a lot more force to try and spring it, there's no spring mobility. Okay, so that's an interesting, finding in which there's a lack of that micro motion that doesn't show up when you test the traditional ways of testing hip motion, and even when you test it when she's on her back with the legs straight. Okay, can we have you lie on your back? Mm-hmm. And the treatment for that reduction of mobility is so simple. I use 2x4 by 8 inch foam, but you can roll up a towel firmly 2 inches diameter and use it. This foam gives a little bit, so it kind of conforms to the body. It's a little more comfortable than hard foam, okay? And so I put the middle of the foam under the trochanter. All right, and we're capturing many hip rotators, There are many more hip rotators than the piriformis who gets all the press, all right? So I teach my patients to do this once a week, and that's all they need. And when you put your hand there, the bend at your knuckle of your pinky is the correct location. That's the bottom of the foam, all right? And then you place it in line with your pelvis. So if you slide down the outside, you hit the foam.
Okay,
got it?
This way, yeah.
Got it? So I'm going to go set a timer for 2 minutes, and we'll stop filming, and we'll come back and see the results.